Okay, perfect. So before we pull up our slides and get chatting all things health equity and what we're planning on doing in this working group and hopefully all together, and this will be only the first time, but not the last that we see you. Maybe we can do a round of introductions. I can run through the list of names. Julie, maybe we can start with you.
Hi, I'm Julie Donovan from the College of American Pathologists, and I'm in Chicago, and it's 6 o'clock here.
Okay, great. Thanks for joining, Julie.
Sure.
Bridget.
Sorry, I had to mute. I am Bridget Anor. I work as a guideline development methodologist with the Registered Nurses Association of Ontario, and I'm joining from Ontario. I'm in Burlington.
Nice to have you here,
Nice
Bridget.
to have you, Andrea.
Thank you. Cindy.
Hi everyone, I'm Cindy. I'm a Senior Research Fellow here at Adelaide University. So I'm based in Adelaide, South Australia, and right now it's 8:36 a.m. in the morning.
Thanks for joining.
Nice and early.
Yeah, that's very early. Elda, I don't know if you're still having audio and video problems. It looks like it. Could you type in the chat so we can get to know you? And I'll move on to Heidi.
Hi everyone, I'm the guidelines coordinator working on the Australian New Zealand Living Stroke Guidelines. I'm based in Australia, Melbourne, and it's currently 9:06 a.m.
Nice to have you. Nice to meet you, Heidi.
Thank you.
Let's see, Marisol.
Hi, everyone. My name is Marisol Hernandez, and like my colleague Julie Donovan, I also work at the College of American Pathologists, but I work from my home in New York City.
Wonderful. Thanks for being here.
Oh, and it's 7:07 p.m. in the evening here in New York.
Hopefully we won't keep you too late for dinner.
I already had dinner, so I'm good.
Oh, that's good. Okay. I see Elda. So she says, I am an infectious disease doctor working in London. I am in Europe in the moment, and it's 1 a.m. here. Thank you so much for joining, and I'm so sorry it's so late.
Love the dedication.
That
Thank you.
is dedication to equity. We appreciate it. Olivia?
Hi, I'm Olivia Demarest. I work for the Society for Cardiovascular Angiography and Interventions out of DC. I work from my home in Michigan, and it is 7:08 p.m. here.
Thanks for joining. Nice to meet you. And then John.
Hi, I'm John Chang. I work with the National Guideline Program at Kaiser Permanente, and I'm based in Los Angeles, and it's 4:08 p.m. here.
Great. Reasonable. But so I think Elda wins in with her 1 a.m. time zone. Omar.
Hi, everyone. My name is Omar. I'm based in Toronto, Canada. I'm a research associate at the Brier Research Health Institute, which is in Ottawa, but I also lead the Grade Equity Project Group and co-lead the Cochrane Equity Thematic Group, specifically the implementation tools objective with Andrea here, and co-leading this working group with her as well.
It's fun.
Very fun.
Thanks, Omar. I'm Andrea. I'm based in Hamilton. I work at McMaster University. I'm an assistant professor at the Department of Health Research Methods, Evidence and Impact, and Anesthesia. I'm also the assistant director of the National Pain Center. So I wear two hats. I love to advance methods within guideline development, guideline adaptation in low resource settings, and the integration of equity in guidelines, but also its application to chronic pain and chronic conditions, mainly among other areas. And then, as Omar said, I also disclosed that I was based in Lebanon at the American University of Beirut and was the assistant director of the Grade Center there about 10 years ago. So time's flying. So yeah, Now we'll get started and we'll walk you through a short presentation. We don't want to do a lot of talking. We want to also be able to open the floor for discussion and talk together about what the future of this working group can look like. So next slide, Omar.
Yeah, I'm just going to turn on the record.
Oh, okay. I have recording on my side, but it's good if you do
Oh,
too.
it is? Okay, that's good.
I do.
Excellent.
I'm hoping, yeah, I'm hoping it's working. I see
Okay,
the red record circle.
okay, great. Great.
So I did really want to start with a land acknowledgement on both of our behalves, Omar and I. And if you feel like you want to share yours, then please do in the chat. But we just want to say that we are very grateful to have the opportunity to work on this land. Me being at McMaster University, that is located on the traditional territories of the Mississauga and Haudenosaunee nations, and within the lands protected by the Dish with One Spoon Wampum Agreement, and University of Toronto, which is on the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. And yeah, we are very grateful to be able to work here. Next. So these are our disclosures, which we went through. And for today, we thought we'd start with why did we think this working group should exist, and our objectives, the mission and vision of the working group, the structure, and then we wanted to go through the key pillars of how we envision this working group actually operating and our ongoing initiatives so far. And then we thought we could open up the discussion for questions and answers, but also to discuss future directions, where we see this going together. So as you know, and I don't need to tell you that, GIN is a global leader in evidence-based trustworthy guideline development. However, for guidelines to optimize care for everyone, we need the appropriate integration of equity in the guideline process so that we ensure that it's addressing the needs of everyone. So this is why our objective really is to improve the quality and consistency of healthcare globally, and that's by advancing the methods of health equity, but also its application in both the development of these guidelines and its implementation. So our vision really is to strengthen health equity globally, and to do that by integrating concepts of equity as they are advanced in the development of guidelines, in the knowledge translation processes, and in the implementation at the level of care. And that could be for, in clinical or public health, or even in health policy, right? And to do that through research, through capacity building, through networking and collaboration with different interest holders and with different groups. Our vision is to create a really collaborative space here, meaningful engagement with different individuals and organizations that are interested, that have a shared interest in health equity, and doing that through, gaining knowledge, so sharing knowledge, gaining skills, and the tools required to be able to better apply equity in your different fields and in the different areas of work. So here is an overview of the structure of the working group. So there is the oversight committee, which includes the co-chairs, which are, at this time, it's Omar and I, but as you know, this changes every couple of years. And our responsibilities is to set strategy with everyone. So to really co-develop a strategy and priorities with the working group, to oversee the initiatives and resources required for the different initiatives, and to ensure and foster engagement and inclusion. And to be able to implement this work as needed. And then ensure alignment across the pillars that Omar is going to be explaining, support member development, and represent the group within GIN and the partner organizations. Now, within the oversight committee, we also wanted to have a leadership team made of 3 members, which right now are to be determined. So it depends on interest and capacity of these individuals to be able to provide support in pushing these initiatives. The benefits of this leadership team would be shaping the future of equity in gin at a more core level, building leadership experience, expanding networks and influence, and making a meaningful impact by informing the work that's ongoing. And then really this oversight committee will be working in parallel with other gin working groups, such as the Public Health Working Group and other. And in close collaboration with our gin board liaison, who's Professor Holger Schönemann, who was also the previous chair of the gin board, who will be providing us with strategic guidance, ensuring linkage with the gin board, and supporting oversight alignment with the gin priorities. And then there's the working group members who will support brainstorming our priorities, supporting the ongoing efforts as needed or within the capacity of the gym members, but also sharing their work, sharing what they've been doing in equity in the guideline space, sharing their experiences, lessons learned, etc. So our overarching purpose is to advance equity in guideline development and implementation, which we've said, and that's through 3 pillars: collaboration, capacity building, and meaningful connection. And this is where I hand it off to Omar, who's going to take us through these 3 key pillars in more detail.
Thank you, Andrea. So as Andrea said, we have a lot that we want to do, a lot of aspirational stuff. And we recognize that we can't do it alone. We need your help. And so what Andrea and I have been doing in the past couple of weeks after getting this working group approved is to think about how we can make this worthwhile for you as members and also worthwhile for the kind of output that we're hoping to produce. So just to also go back to this slide here, this is really the first part where we think that you can engage you in something that is worthwhile. If you would like to be involved in this leadership team, we would really appreciate you reaching out to us. We'll probably send out a survey, I think, Andrea, or a form that we could circulate, and you guys could tell us just a bit more about yourself and why you would be interested in taking this on. But not only is this only good for academic development, but this could make you a bit more closer to the leadership team of the working group and more likely to be taking on responsibility as co-chairs after our term ends. And so we came up with these 3 pillars. These are the 3 areas where we would like the working group to basically operationalize advancement of health equity. The first one is related to research. The second one is capacity building, training, and sharing experiences around how equity is being used in guidelines. And then the third one is with regards to networking and collaboration, recognizing that all of us really appreciate the power of gin as a place, a hub where like minds connect, and a place where you could find future opportunities that align with your career goals. And so we want to facilitate that as well, and I'll get to that. So the first one, which is about the research, we have already established a priority project for the gin equity working group, and that's that we want to make a equity and guidelines toolkit. So some of you might have been familiar with the gin public toolkit. So that one focuses a lot on engagement, how to do proper engagement, who to engage, and is always being updated year after year to make sure that it's relevant to the latest methodology. We want to follow suit from that perspective, and having a tool like that we think will be very, very useful for the gin community as well as other members outside of gin. So the whole idea behind this toolkit will be to highlight some of the key frameworks in considering equity and guidelines, having some knowledge translational tools like flowcharts and checklists that could help people achieve these or operationalize these frameworks, and providing detailed implementation guidance. And so we would love to have people join this project as part of their contributions to the working group, and definitely will get credit as as appropriate. And of course, we're still thinking about how this could potentially translate into a publication. But at the minimum right now, which is what Gin Public has done, is that this toolkit has been placed on the website, and your name will be included. With regards to ongoing projects, the one project that Andrea and I are leading is equals. So this is a critical appraisal tool for health equity considerations and guidelines. We've done a lot of work in developing the tool and assessing its internal validity. But what we want to do within the next couple of weeks or months is user testing. So you are more than welcome to get involved and also bring in people that you think would be interested in doing this to be part of the user testing process. And we would really appreciate your feedback on how usable you think this tool is, and share with us your experiences. But of course, that's us. We want to know what you guys are doing and whether you think that there are projects that we could bring within the fold of Gin, or projects that you think that Gin members would benefit in being involved in formally or informally. And we can talk about that at the end. Second pillar that we have as part of our working group is capacity building. So we thought about having a series of 3 webinars per year to just methodologically oriented to talk about why equity is important in guidelines, what are the methods that are available right now, and we want to bring in people from other working groups to talk about how equity is important for them and what are the areas of intersection, just to act as a, let's say, it could be a learning platform for all of us, but as well as establish the importance of equity in our work, and that would likely encourage us to promote it in our workspaces. We also recognize that people look at equity a bit differently depending on the guideline topic, depending on the organization where they are. So we would also love to invite all of you to come talk to do a webinar or something like that, and share with us your experiences with incorporating equity in your guidelines. So that could be another part of this pillar. The third one, which I really, really think is a unique idea and is going to be a great contribution to the working group, is the networking and collaboration pillar. So we recognize that there's different levels of expertise within the working group but we all have this similar interest of looking for opportunities to incorporate equity as well as learning from experts in the field. So what we would like to do is basically establish a hub where we could gather all this information and connect people who are interested in opportunities as they arise according to their interest. But at the same time, as you've all introduced yourselves, all of us work in different places of the world and have different affiliations. Maybe there are teams that we would be willing to work on, shadow, learn from. So disclosing our connections and our networks could be of benefit for other members and opportunities for them as well. So those are the 3 pillars that we have, and these are the current areas where we think that are opportunities for members to join, and it would be definitely worth their while. So the first part is the leadership team. Second part is being interested in equals user testing. If you also share with us your ongoing projects or project ideas that you think that we should embark on, you could lead that, or you could co-lead it. We can always talk about that stuff. And representing case studies to the working group, I think that would be very, very beneficial. And then the networking hub where you can benefit yourself and also benefit others with your networks. So those are it for our slides. We would like to hear from you guys, what you guys think.
But yeah, Omar, is it okay if we just go back to equal for a second?
Yes.
I thought it would be a good case study to kind of explain really all of these pillars. So really with equal, we recognize that there was a major need in assessing whether equity was properly integrated or considered in the guideline process, right? But to have meaningful collaboration, we reached out to the Agree team. I'm sure a lot of you are very familiar with the Agree enterprise and the tools such as Agree 2, which is a global tool for assessing and appraising equity in guidelines. And as they update their work, we are hoping to inform that and any other tool that is developed for that purpose. So really, we don't want to be in an isolated hub working on things that are not being integrated into other tools, frameworks, and efforts that other people have already been implementing. We want this to be meaningful and actionable. So as we brainstorm and prioritize the work that this working group will be doing, we want to keep that in mind. We don't want to be working on things that will end up not being beneficial in real world scenarios. And we recognize that in different organizations and different institutions, equity is considered in a different way and in different capacities. So I just wanted to put that out there, and hopefully that would help inform all of us, inform the ideas that come to mind and the ideas that we'd like to implement here and see come to life. So yeah, that's it.
That's a very important point, Andrea. It's been great to put things into perspective. So we'd like to hear from you guys what you think.
Or what you hope to see from this effort, what you're looking for, whether it's seeking support or wanting to run ideas of your own through this working group that you'd like to see come to life and you'd like the support of the team.
I'm going to also share and so we can see each other. Put things in the chat.
Do you want me to start?
That would be great.
Yeah, no, thank you both for presenting that. I think it sounds like, and obviously it's initial, but there's a bit of a mix of everything. It's methods, it's network, it's actual guideline development. But I think the interesting point, particularly for me, is implementation. Once you've got that guideline, how can you go the next steps? Now, I've been involved in June for a little bit, but I guess this is my first opportunity to be, or my first step in the working group realm. Is there this might be more of a generic question, is there like a more generic terms of reference for working groups? Like what are the expectations for working groups? Like is it, regular meetings? Is there activities, I guess, just in more general terms about what is the terms of reference for this group?
Omar, would you like to start?
Yes. Thank you, Cindy. So with regards to terms of reference, they are not standardized by working group, but I want to just make it clear. It sounds like we do have a lot that we want to do. And the only reason behind that is because we want to make it worthwhile. So most of you guys are part of organizations. Maybe your organization has already paid for your membership. Other people are paying out of pocket. Recognize that there's an exclusivity to this. And so the way that we have framed this working group is that we want you to find value in being engaged in this working group and find this worth your time. So that's why we came up with so many different avenues for you to be engaged. There's also the option to not be. So you're not really forced into any one of those, and you can attend the webinars freely. You can come to our we were talking about quarterly meetings, or even no less frequent than that, to just update the working group on what's going on, so you could attend from that perspective. But the whole idea was to try to engage people as much as possible, and that was also feedback from other working group leaders who told us that keeping the interest is one of the hardest things.
And yeah, I think that's very true, Omar. And I think really the way I envision it as well is that some members will want to come in and ask questions and say, we work within this organization, we're doing this guideline, we're having these issues. How do we go about it? And we can have an open discussion based on our experience, based on, new guidance that's coming out, and try to help that person navigate the issues that they're presented with in their application of equity, right? It could be that. But what we would hope for is that we're building a community that wants to also advance these processes, whether it's methods of, integration, or it's, how to implement, how to assess whether, these equity considerations are being implemented. So there's a lot of questions that are left unanswered in this space where we're continuously learning and this space is continuously evolving. So we're hoping that we could brainstorm ideas together. So let's say, Cindy, if you're working in this space and you recognize, there's a gap that could be addressed, maybe that could be, put forward as one of the ideas or priorities. And then through another process, we could identify whether we have the resources and the tools and the ability to actually address that question and maybe together undergo that research. And, the more if you put the time in and you meet ICMG criteria, you could get authorship, you could play different roles, but that's up to each and every one of you and how much capacity and interest you have. And we're hoping that's a lot, and that we really create a community that's working together to push a lot of these ideas forward. I hope that answers your question. But in terms of leadership, Tim, so if you notice, we said to be determined, there's 3 members that we'd like to be part of our core team. There will be a TOR for that, because for you to be in that position, you would need to have the interest, but you also need to have the capacity and the consistency to be able to conduct the work that is needed, right? As part of that oversight core team. We'd also like to hear, so maybe you don't want to come up with ideas right now, but we'd love to hear from you, how have you been considering equity, if you have, or if you haven't, why you would like to be, or really coming in the capacity of, like, in your position at work, what were you seeking to hear from us today? What would you like to see from this working group? What are you hoping for, really? Bridget?
Yeah. Thank you so much, Andrea and Omar, for this insightful presentation this evening. I think I'm already excited for this group, for all that is to come and all that we'll be able to contribute to it. And so for me, I am currently working on a guideline that is seeking to include equity. And so I truly believe that this will be a learning opportunity for me on how best we can include equity in this guideline. But I'm also hoping to also contribute my experience so far to the group. And so I hope that it will be a learning opportunity for all of us here. So thank you for the work that you've put in so far.
Great to hear. Thank you, Bridget.
I could go next. So at Kaiser, we've been thinking about equity for a while, and there are actually 2 main areas that we've been focused in for trying to standardize our guidelines around. Is first on topics that might have some racial equity to it in the U.S., and the second is, of course, on gender equity as well. And we follow a framework that was designed by our colleagues at the Center for Health Research at Kaiser Permanente Northwest. They work with the United States Preventive Services Task Force, although that's a group that might not be going in the direction that we want at the moment. But that was a couple of years ago. And I'm always interested in thinking about, and maybe that's what I think I latched onto one of the slides, that maybe, again, through our conversations and through how other people are addressing this or looking at their lens differently, I'd be curious if we can come up with an international framework. And then, of course, I don't know anything about your equals assessment tool, but I'm curious what it actually measures and whether or not how we, it's okay, right? It exists, but then how, as we come up with an adaptation of a new framework, how we're tracking and successfully addressing equity in guidelines. And then I did not in my introduction mention, I also teach medical students and residents at the Kaiser Permanente School of Medicine in the Department of Health System Science. So I'm always curious about what we can also teach our residents and medical students to think about as they grow into both evidence synthesis and guideline development work in the future.
Thank you, John. I think Omar and I can answer a lot of these questions. Maybe I can start with equal in saying that well, actually, I want to take a step back and just I think it's important that we acknowledge that any tool out there that we have developed or other groups have developed will likely have limitations. I don't think we can develop a tool to address different ways of knowing, for example, right? And we need to acknowledge that. We may be able to adapt it with the appropriate engagement from different groups that may, be using different ways of knowledge in conducting their research or in their ways of, of building knowledge. So I want to say that equal really is based on tools that we've already developed or we already use. And it's part of our disclosures, right? The fact that we are grade members, we're very involved in a core capacity in different working groups. We use grade in developing our guidelines or grade development for adaptation purposes, and the Gin McMaster framework, right? And then there's a Gin McMaster extension checklist on equity, which Omar can address, and he's the one who led this work. So the appraisal tool really accounts and is building on those foundations. And we're happy in another call really to go into more detail if you're interested, especially if you're interested in user testing. But we're building on those foundations, on the 7 principles that we identified by developing that work. And they're going to reflect that, right? And I think in a way that's a strength because we've already done all of this work, but it's also a limitation if you tend to use different approaches to guideline development or you use different frameworks. I don't know if we can standardize, but we do hope that we are addressing key priority or minimal requirements on how to integrate and consider equity, or at least consider, right? Consider equity appropriately and have that reflected appropriately in the guidelines. I'll stop here for that. And in terms of teaching also, right? So there are ways that we are integrating all of this into our own academic roles, and we can absolutely support you in doing that and integrating equity into your slides and into your presentations and lectures. And we can connect offline for that as well if you're interested. But I'll let Omar chime in.
Thank you, Andrea. And it's great to hear from you, John, actually. So Andrea mentioned the Jim McMaster Equity Extension. We developed that in collaboration as well with Jennifer Lin, who you must know.
I work with.
So she collaborated with us on this, and so we've really put in a lot of effort. I've got people from Australia, people from across the world, China, to develop this international framework for equity and guidelines. But we do recognize that the implementation part is missing. So how is this going to run in real life cases, and what are the resource burdens and the barriers to implementation? So there's definitely follow-up work there. And this could be something that we could take on as the Gin Equity Working Group. And also, what you say speaks to the fact that there's been a lot of production within the field, but very little awareness on what's available and what's not. And I think this is one of the main things that we can benefit each other from within this working group, whether that's through making the toolkit as a central source, or even just having a shared document of resources so individuals can, that could be our rapid resource, Andrea, to share published tools and the guidance for different parts for equity in the guideline development process. But I'm really excited to see the enthusiasm, and with regards to teaching, as Andrea said, I think we can develop slides to make them shareable, really, with appropriate credit. That could be shared widely, and you guys can take the lead on it.
Yeah, no, so I also cross over with the Guidelines in Medical Education group with Dr. Alam. So if there's something we can also cross-pollinate there, I'd love to think about that.
Sounds great.
Yes. Because as we said in the presentation, we're always seeking cross-collaboration with other GN groups. So if you think there's an opportunity there, let's connect offline and discuss what we can do.
Great, thanks.
We'd also love to learn from your experiences. So for example, with Equal, we're hoping to identify examples, right, for each of the steps and what different groups in real world scenarios are doing. How are they being able to address these concepts? What's reasonable, what's not reasonable, what's within their capacity, right? We're not aiming to punish anyone because, there's different ways of addressing different, topics. And we want the tool to reflect that. And all we're hoping for is that people are considering one way or another with the resources that they have and with the knowledge that's available, because we also recognize that there's not a lot of equity research in all areas. So, people usually tend to say, why do it at all? Why consider it at all when we know there's nothing out there? But just by asking the right questions, you start pushing, the concept of equity and guidelines forward.
I mean, I can throw out one concept that we're kind of challenged with at the moment because we're trying to, as you may know, in the United States, they recently updated the cholesterol guidelines from the American Heart Association. And the main focus of that, of course, is using the new cardiovascular risk calculator called PREVENT. And that calculator is touted as being race neutral. However, when we start looking at different groups, data internally at KP using that calculator, it tends to underestimate in certain racial groups. And so it's this challenge of, right, and race neutral sounds like it's going in the right direction, but I think it shouldn't be ignoring looking at the data and seeing how that could apply. And so we're thinking very hard about how that might locally have to have us change some of our recommendations tied to the guideline.
Very interesting.
Yes, very interesting. I think this equity and prognosis and prediction modeling is something that we need to work on methodologically. Sorry for cutting you off, Julie.
Oh, no, I was going to add to that. Marisol and I are also here. We are working on a guideline for that currently is evaluating the use of race in serum prenatal screening. It's been quite a ride for us as we have two very distinct groups of people on our panel, those that are adamantly in support of including race for scientific background reasoning, and then a group that is very much against it. So we, I think, are looking for some support for this from this group, because this is, I don't know if you want to chime in, Marisol, but it's been a contentious time in our meetings. And then also at our organization, we do use grade. And so when we get to the equity piece, we always are not sure if we're covering it correctly with our panels, because we don't know, like, if we are recommending NGS, that's more expensive. It's better, but is it equitable? Does everyone have access to it? And we don't know what kinds of questions. So we are looking for some standardization or some kind of help to help us at least get through that framework. So that's where I'm coming from, at least Marisol. I don't speak for you, but we are on the
No,
same project together.
yeah, absolutely. Yeah, definitely what, Julie has summarized here. We have this guideline with considering race and prenatal serum testing has been contentious. It's been a difficult ride. And in addition to that, yes, there is always a struggle, not only with this current panel and this current project, but when we use grade, the equity seems to be a point where all, the panels struggle. They struggle with that. And as they, try to develop their recommendations. And I guess, I came into this equity group here today because I wanted to build my limited knowledge on how to consider equity throughout our guideline development cycle, considering the fact that we are not clinical per se. This is laboratory medicine. So that is also an added challenge when we try to think about how do we insert equity considerations in our process.
I'm really happy with what I'm hearing because you're making me think about a lot of things that we need to still do for equity. I reached a point where I felt we covered a lot of the base. But with regards to the first part, I think it's really interesting how you're referring to this contention within the panel. And of course, I can't really provide, and myself, I think, and Andrea can't give you a solution right now because we don't have good enough context. But I think one great way to do this would be to, if you would be willing to present to the working group, maybe what the contention is and what are the opinions. And we as people who have equity experience and will make sure that there's other individuals as well who could provide some meaningful feedback could, chime in and tell you how to address that. That would be, I think, a nice way to go about it. And I think that goes for everyone, right? If you feel that you have an equity challenge, it could be time sensitive. We could organize something in a short time frame and try to get people from the working group as well as maybe from outside the working group as well to give some guidance. That's for the first part. The second part, the equity box in the ETD has been a challenge for a lot of people. So that's not just your experience. We have recently got we have been working on guidance within the grade equity group on addressing the ETD criterion. We recently got it approved at the grade meeting around 2-3 weeks ago. Hopefully we will be submitting that soon, but in the time being, I am more than happy to present to you the guidance. And we can prioritize that as part of the webinar series, since that seems to be a demanding topic.
And I think
Sounds good?
it's great to add to the toolkit, like some real world examples and how they were addressed. I think that would be really helpful for others that, are seeking those examples to kind of emulate that in their own work.
Great.
Yeah, and I'm happy to present this situation to you if you want. Give me some time to write it up and get anybody's feedback. We'll take whatever we can get.
Whenever you're ready.
Yeah.
Elda, I see your hand up. Oh no.
No, unfortunately, we can't hear you.
Unfortunately, we can't hear you, Elda.
Maybe you can use the chat box and we could see if there are any other comments, concerns. I think we've kind of gathered that there is a greater need and the desire for capacity building within the working group and a focus on um, available methods. And through these discussions, we're realizing that there's a lot of other gaps that we need to address, right, Andrea?
Absolutely. Yeah.
Yeah.
I think
Can
this
you
was
hear
a
me
great
now?
discussion. Oh, yes. Hi. Good to hear your voice.
Sorry.
Yeah.
Sorry. Just my comment. So in terms of expectations, I was expecting exactly these opportunities from the meeting. So education, networking, and new ideas. So my experience, I'm working on a project called Opening, which is on incorporating ethics in infectious diseases guidelines, as we think there is a lot to say in the infection field. And I've read some of your articles, especially Omar's. So I think it would be great to discuss more about this, as I think at this stage we have completed the project. So it would be great to have your opinion. My proposal in terms of idea, because it seems we have already talked about these today, would be maybe to understand in different medical specialties if there are different needs. So laboratory toward versus for in my experience infectious diseases, but could be pediatrics. I don't know if could be an idea to understand if different needs apply with examples to different specialties. And then, in terms of education, we ran a survey on ethics and infectious diseases a couple of years ago amongst participants to an EUID conference. And a large percentage of participants said they would have liked to know more about ethics through courses, webinars, and case discussion was a big one. So I think really case discussion and education would be key. So it was too long to put in a chat, so I've tried to, tell you all of these.
I think that's great. Thank you, Elda. And yeah, we agree.
Yeah, and you don't need to apologize. Great that you're able to voice your opinion. It sounds like equity in biomedical research is is the next thing. I'm intrigued, honestly. I want to think more about that. So, Judy and Marisol, would you say that you have expertise in preclinical research, like as content experts, or is it you guys bring in just methodological?
No, I'm a guideline development manager, but I did used to work in a laboratory, so I ran the test that they are talking about. But the PhDs on our panel are the experts. We have two pathologists, and the rest are mostly PhDs. So.
And my role in at the college is that I'm a medical librarian specialist.
Okay, great. Great. So, but if we need that content expertise, do you think you're able to
Yes.
connect us?
Yes.
That's good. Any other thoughts from the people? Are we happy? Andrew?
I think it was a great start. It was really great meeting you all.
Oh, thanks.
Now we've realized we have way more problems than we thought, which means all the more reason to have this working group, right? Because we need solutions.
Yes.
So hopefully we can start doing that together. That's great.
Okay. Yeah, I think that's all that we had for you guys today. Is that right, Andrea?
Yeah, but please do, if if there's anything that you didn't think to say now, or you had other thoughts, please do share with us. You should be able to find our emails, but we can also jot them down in the chat. And hopefully we'll see you again in the next
Yeah. So actually, Andrea, sorry to cut you off. Do we have a way of communicating with the members? Like if we want to send like meeting minutes,
Yes, through the GIN website, we'll need to talk to Joanne to see exactly where and how, but I'm pretty sure we should have a dedicated page and we'll be able to post things there.
yeah. And also if you would like to all put your emails in the chat, I think we would benefit from an internal list as well.
Great.
Yeah. Just make sure that we don't lose the chat.
No,
Are you able to share your deck?
Yeah, this will be recorded and shared on the GIN website for sure. And it'll be circulated because a lot of people wanted to join and couldn't because of time.
Great.
Sorry, guys, you guys said that you'd reach out about the usability or the user testing. That will all happen
Yes.
after the meeting. Yep, great.
So not yet because we probably need ethics approval for that, which we're working on currently. We're going through a modified Delphi process to develop the tool with a team of interest holders that we have from globally. We're almost towards the end of it, and hopefully we'll start validation and user testing next. We will make sure that information is disseminated through GIN and other groups and make sure that you are all aware and are able to participate if you're interested. And if you're interested in the meantime in knowing more, please let me know and we can definitely chat offline.
So we secured the chat, Andrea?
Yeah.
Good, excellent.
I took screenshots. I thought that was the fastest way to do this.
Yeah, it is. Okay.
Okay.
I think if there's nothing else, that's all for us. We'll make sure that we continue to meet, on a semi-frequent basis, so we keep touching base.
Absolutely. In the meantime, have a great day, great evening, wherever you are in the world.
Okay. Take care, everyone.
Thank you.
Bye, everyone.
Bye.
Bye-bye.